Hi everyone, welcome back to my YouTube channel, and today we are going to talk about metastatic bone tumor. So let's start our topic with introduction. Metastatic bone tumors are secondary malignant growth in the body that originate from cancer elsewhere in the body. They are most common type of malignant bone lesion, far more frequent than primary bone cancer. The skeleton is a common site for metastasis due to its rich blood supply and bone marrow environment. These tumors can cause pain, fracture, and other complications significantly affecting quality of life. Common primary sources of bone metastasis. It can come from breast cancer, that is most frequent in women. It can come from prostate cancer, that is most frequent in men. By lung cancer, kidney cancer, thyroid cancer, and gastrointestinal cancer, that is though less common. Pathophysiology of bone metastasis. Cancer cells spread through bloodstream or lymphatic system to bone. They lodge in bone marrow and disrupt normal bone remodeling. There are two main types of lesion that include osteolytic lesion and osteoblastic lesion. Osteolytic lesion is when there is bone destruction due to increased osteoclast activity. It is common in breast and lung cancer. Osteoblastic lesion is when there is excess bone formation due to increased osteoblast activity, and this is common in prostate cancer. Mixed lesion may also occur that include both osteolytic and osteoblastic properties. Clinical features. It has persistent bone pain that bursts at night. Pathological fractures are there due to weakened bone. Spinal cord compression if vertebra is involved, and hypercalcemia, especially in osteolytic metastasis, is there. And swelling or deformity in affected bone also occur. Common site of metastasis. First is spine, second is pelvis, third is ribs, fourth it involves skull, and then long bones, for example femur and humerus. Diagnosis of metastatic bone tumors. First we do is clinical evaluation that includes history of primary cancer and bone pain history. Second we can do is imaging, in which we do x-rays that shows lytic or sclerotic lesions. We can do bone scan that detect multiple metastases. We can do CT and MRI, that is for detailed assessment of lesion extent and spinal involvement. We can also do for diagnosis laboratory tests that include elevated calcium level and tumor markers that depends on primary cancer. We can also do biopsy, that is to confirm diagnosis if primary source is unknown. Treatment and management of bone metastasis. First we can do is systemic therapy that includes chemotherapy, hormonal therapy, or targeted therapy depending on the primary cancer. Second we can do is bone targeted directed therapy that includes bisphosphonate that reduces bone resorption, and densumab that is monoclonal antibody that is against rank L. We can also do radiotherapy that is effective for pain relief and local control, and surgery for stabilization of fracture and decompression in spinal cord compression case. We also provide supportive care to this type of patient that include pain management and correction of hypercalcemia. Prognosis. Prognosis of metastatic bone tumor depends on primary cancer type, extent of metastasis, and response to treatment. Bone metastasis usually indicate advanced diseases. While cure is rare, treatment can improve quality of life and prolong survival. Conclusion of this lecture video. Metastatic bone tumors are common complications of advanced cancer that lead to significant morbidity. Early detection, multidisciplinary management, and supportive care are essential to reduce symptoms and improve patient outcomes. Advances in systemic and bone targeted therapy have improved survival and quality of life for patients with metastasis. And this was all about metastatic bone tumors. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.